If you're watching this video, you or someone you care about may have been referred for a cardiac CT scan. And I'm sure you have a lot of questions running through your mind right now. What exactly is a cardiac CT? How do you prepare for it? And what can you expect during the procedure? My name is Dr. David Tran, and I'm a clinical cardiologist and a cardiac imaging specialist. I'm a Level B accredited, which is the highest standard in Australia, with over 10 years of experience. I review and report cardiac CTs as part of my daily practice, and I can tell you that it's a very common and incredibly important procedure in diagnosing and managing heart conditions, which is why I want to give you peace of mind and run you through the step-by-step process of preparing for your cardiac CT, what happens during the procedure and how long it takes, the different parts of the cardiac CT scans and what they can reveal about your heart, how the results can guide your treatment plan and improve your heart health. Ready to dive in? Let's go. A cardiac CT, or computed tomography, is a non-invasive imaging test that uses X-rays to capture high-resolution cross-sectional images of your heart and coronary arteries. The images then undergo post-processing to generate angiographic images of your coronary arteries and 3D images of your heart. Prior to the development of cardiac CT scanning, the only way to gather this anatomical information about your coronary arteries was to perform invasive coronary angiography, an intrusive procedure performed in hospital requiring sedation, where doctors would introduce catheters and wires directly into the arteries of the groin, or the wrist, to gain access to the heart for imaging. There are two main components to cardiac CT scans. The first is calcium score screening. This measures the amount of calcium buildup in your coronary arteries, which is a marker of atherosclerotic coronary artery disease. Coronary artery disease is a condition where the arteries that supply blood to the heart muscle become narrowed or blocked due to the buildup of plaque. The second part of the cardiac CT scan is known as the CT coronary angiogram. This involves injecting a contrast dye into the bloodstream to highlight the coronary arteries, allowing your doctor to identify the narrowings or blockages. Your doctor might recommend a cardiac CT if you have chest pain, shortness of breath, or other symptoms that could indicate a heart problem. It can also be used to check for congenital heart defects and also in the evaluation of the effectiveness of a previous treatment. Preparation is the key to getting the best possible images of your heart. So let's talk about how to prepare for your cardiac CT. Your doctor will give you specific instructions on when to stop eating and drinking before the test, usually around 4 hours prior. If you're having a CT coronary angiogram, you'll need to avoid caffeine for 24 hours before the test, as it can affect your heart rate. You may be asked to take a medication to slow the heart down before the scan. Often it is prescribed by the doctor at the time of ordering the scan, in which case the doctor will advise on the correct dose, or it can be given on the morning of the scan. You'll be asked to remove any metal objects such as jewelry or clothing with zippers, as that can interfere with the X-ray images. If you have a contrast dye allergy or have had a reaction to contrast in the past, let your doctor know beforehand, as they may want to prescribe medications to reduce your risk of a reaction. During the cardiac CT procedure itself, you can expect the scan to be relatively quick and painless, lasting only between 10 to 15 minutes. You'll lay on a table that slides into the CT scanner, which looks like a large donut. The technician will place electrodes on your chest to monitor your heart rates during the scan. If you're having a CT coronary angiogram, the technician will administer a medication called nitroglycerin under the tongue, and that will dilate the heart arteries. Once the heart rate is slow and steady, often under 60 beats per minute, and when the arteries are dilated, the technician will inject the contrast dye into a vein in your arm. The scanner will anticipate when the injected dye will reach the coronary arteries, and you'll be asked to hold your breath while the scanner takes images of your heart. Modern scanners are fast and powerful enough to take a picture of the entire heart over the period of less than 1 heartbeat. After the scan, you'll be monitored for a short time to ensure there are no ill effects from the medications or the contrast. Once your doctor has the results from your scan, they will have a better idea as to whether your symptoms are due to coronary artery disease. The images will also give an indication of the burden of disease, which has a direct relationship with prognosis. The main arteries of the heart can be isolated and viewed from different angles, which will highlight the severity of individual plaque lesions as well as the plaque characteristics. Some are more favorable than others. A normal cardiac CT scan will have no evidence of calcium deposition, and there'll be no evidence of coronary plaque. This suggests that coronary artery disease is absent or so minimal it can't even be seen by this technique. The chance of having a heart attack over the next 5 years is very low in these circumstances. On the other hand, an abnormal test means that coronary artery disease is present. The location of the plaque, the nature and severity of the plaque will help your doctor create a personalized treatment plan to manage your heart health. This might include lifestyle changes, medications, or further testing and procedures if necessary. As it is a CT scan over the heart area, we will also see parts of the lungs, chest wall, and upper abdomen. Sometimes this can also give us clues as to what is the cause and what is not the cause of the symptoms. So, in a nutshell, a cardiac CT scan is a non-invasive, quick, and powerful tool that can give you and your doctor a detailed look at your heart health. If you have any further questions or concerns about cardiac CT or your heart health, please visit our website at connectcardiology.com.au, and thank you.